Welcome to Auditory Precision. Today we're going to talk about different ways to modify the hearing aid to change the quality of sound without utilizing programming. And the three main ones that we have are vents, dampers, and horns. Vents is what we tend to utilize the most and know the most about because it affects low frequencies. And a lot of times this is what will cause the patient to sound hollow or their voice to really sound loud, and therefore it's hard to ignore. Later on in this video we'll get into IROS vents, which is one of my favorite. But we will start talking about vents, and vents is usually something that will start at about 250, and it can affect the hearing aid up to about 1200. Now, we usually talk about it strictly with lows. And what we end up doing is if somebody, especially with a custom hearing aid, their lows are pretty good. Now, usually with adults with presbycusis hearing loss, we will see a hearing that will have some sloping and they really suffer in their highs. So what we want to do is make sure that we're not over amplifying their lows. And so what we will do is we'll create a vent. So say this is my hearing aid. I have all of my components in here, and then out here comes my receiver or speaker, and underneath it I'll have a parallel vent, which is always the vent that is used the most. Now this diameter is going to mean a lot for my success. What will happen is if somebody has really good lows, I'm going to want a large vent. And this will allow lows to escape, keeping the sound pressure level in the ear low, and therefore their voice won't sound as booming as it would without a vent. And this is usually something that I want to utilize if I have 40 decibels or better. Now, if I have maybe 40 to 70, I'm not going to want to use a large vent, maybe a medium to small vent. And we have to understand that, just like with any solution, if you push it too far, you'll have secondary side effects. If my vent is too large, not only will I increase the risk of feedback, but I'll also allow that gain to escape. And somebody who actually does suffer in the low frequencies, I don't want that to take place. I need to keep some gain in there. So I'm going to change the shape of my vent. And going in that direction, if I am 70 decibels or worse, I might not even want to use a vent because I'm going to want to keep all of the gain in there. And usually somebody that has their lows way down here, they won't even have that issue with the voice that we're talking about. So now after lows, we have mids. And something that we can do to enhance mids without utilizing programming is something that's used a lot with BTEs. So here I have an ear hook, and then my tube will come down, and then I will have my earpiece. Now some of your ear hooks you'll notice won't have anything in there, and then some you'll notice it almost looks like a small piece of cotton, and that's called a damper. And what we end up utilizing this for is this will actually help increase mids. Now, talking about the presbycusis hearing loss that we see with most of our older patients is, well, why would I want to increase mids? Well, one of the reasons why this is popular is because we're still using BTEs with pediatric cases. And my son has a BTE, and his has a damper in it because a lot of times we'll find a congenital hearing loss that will look like this, or called a cookie bite hearing loss. And so say this is 8K and this is 250, and again we're talking about hertz, is that they tend to do better in lows, they tend to do better in highs, but it's the mids that they suffer with. Okay? And again, I can do a lot of stuff with my programming, but naturally if I add a damper to that ear hook, I can start to bring up these mids and make treating the hearing loss a lot easier. So the last thing is horns, and this is going to affect highs. Okay, I know my chart here goes out to about 10,000, but everybody should know that programming, usually we're talking out to about 8,000. But if I want to increase my highs without utilizing programming, What I can do is add a horn to my ear mold or even my custom. And in this case, I'll talk about an ear mold. Now, Libby Horn was one of the gentlemen that helped create this. So again, let's say I have my BTE and I have my ear hook. Sorry about my terrible drawings. And I'm going to kind of enlarge this so you can kind of see what's going on. Okay, so this goes all the way out. And you'll see that the diameter doesn't change. With a horn, what will happen is I will create the end to have a bell shape. So this will actually get larger as it starts to go into the canal. And what this will do is naturally increase highs. Now there's a couple ways to do this. Sometimes they'll have it open up like this and become wider within the ear mold. Or sometimes they'll do the horn method where it'll actually just kind of increase out this way. But if I can get the opening to be a wider diameter than where it starts here, I can naturally increase highs. Again, not have to utilize programming as much. And therefore, hopefully make my life a little bit easier. Welcome to Auditory Precision. And what we're talking about is vents, dampeners, and horns, modifications that we can make to kind of change the sound of a hearing aid without using our programming. And so there's a lost technique, kind of, the IROS vent. Very easy to do in the office. I'm a big fan of it after I've done it with a couple patients and had great success. And what this is kind of showing is what we're doing with an IROS vent. Now, the thing is that we always do want a long canal. For the most part, that can help with the occlusion effect. But we also keep in acoustic mass. And if we're taking that vent, which usually goes right up to where the receiver is, it's right below it. It is something that we can kind of trap acoustic mass in there. And by bringing back the vent, what will happen is we can decrease the sound pressure level in there. So what I'm talking about is a hearing aid to where here's where my receiver is and here's where my vent is. Okay? What I would be doing with an IROS vent is I would still be having the hole where my receiver or speaker would come out of, but you can see my vent has been cut back. Okay? And so what this graph is showing is that the green line is showing a parallel vent. Okay? A parallel vent is basically something with a hearing aid where the vent will go right below what we were talking about. So here's my hearing aid. I have all the components in here, and then comes out, this is where my sound is coming from. A parallel vent is just going to go through it. Okay? There are diagonal vents where what will happen is I will kind of diagonal my vent so it will all come out this one opening. It's really not something that is beneficial. It does help, I guess, with comfort. It's usually used in pediatric cases or somebody with really small canals. So if you are going to utilize a traditional vent, you do always want to do parallel. But going back to the IROS vent, utilizing a parallel vent where I didn't cut back my vent, you can see that I've kind of naturally increased my lower frequencies. By all of a sudden cutting back the vent here, this red is showing something to where if this was at 22 millimeters, this red would be at 14 millimeters. So just by decreasing it that much, you can see my lows have dropped. And then this blue line is at 10 millimeters, and you can see that it's dropped even more. So if you're having an issue with a patient really, hearing their own voice, what we can do is we can decrease the acoustic mass, which will drop the sound pressure level and a lot of times help the patient with their own voice, and it's worked wonders for myself. So speaking about IROS vents, I'm going to attempt to do is show you how to create an IROS vent on this older full shell. Now, the full shell has a hypoallergenic coating on here, so just kind of cutting into this will not look as pretty as it would on just an acrylic hearing aid. And you can see here we're already dealing with a very large vent. So this might not be a hearing aid that would actually even need it. However, I do want to cut this vent back and kind of show you how I do it. So what I end up doing is I find a good size burr bit that's basically not going to be so small, but obviously not too big to where I can't keep some detailed skill involved. And we're going to see how this goes. So again, you kind of have this that we're going to sand off. But you can see that I started to drill on top of the vent, or I should say on the bottom of the vent. And now what I've done is I've cut it back. So what I'm going to do now is kind of clean this up with using some sanding, not just a drill bit, and then I'll come right back. So what you can see here is that I try to smooth it out as well as possible with a drill bit like this, just because I'm not dealing with just perfectly flat surfaces. So this always allows you to get a bit more detail. But to kind of show you the shape that you're going to want to be getting, you can kind of see here that what I want is my vent to just be cut back. This will also create a larger vent hole, which will also help out. But again, for it to be an IROS vent, I'm cutting the vent backwards to be basically shorter than my receiver or where the filter is.